We're back now with our panel. Steny Hoyer, there's been a lot of back and forth. The senators say the House has to go first. Some in the House are reluctant to go before the Senate goes. Are you, number one, willing to go first, and don't you have to?
Whether we're willing or not, we have to go first if we're going to correct some of the things that the House disagrees with. Change so that we can reach agreement. The House will have to move first on some sort of corrections or reconciliation bill, which follows a process that the Republicans followed 16 out of the last 22 times it's been done for very major pieces, including their tax cuts, which were really of more
You're talking about
value.
that Senate's going to have to go and do it by what we call reconciliation.
Reconciliation.
Parliamentary term.
It's a parliamentary term, but it's simply a process that the Senate adopted to allow it to deal with, in an expeditious way, issues that relate to the budget. It's called reconciliation, fancy term, been used, frankly, more by Republicans than by Democrats, but used by both parties and accepted as a good process.
So let's ask Senator Colburn, you'll be over there in the Senate if the leaders there do decide to try to do this by reconciliation. What will Republicans do if that happens, Senator?
Well, I don't know what we'll do. The first thing, there'll be a fairly significant amendment process that will have to go through, but I'd make a couple of points on reconciliation. Welfare reform happened with reconciliation. Half the Democrats voted for it. The Bush tax cuts happened with reconciliation. 12 Democratic senators voted for it. You didn't have a real partisan issue on those times that it was used. You know, the danger of what's happening right now in terms of using reconciliation is the purpose of the Senate's going to be defeated, and that is to bring consensus to big issues in this country so that we have a reasoned and thoughtful approach and that the American public buys into it. If you use reconciliation on this health care bill as we see today, what you're going to have is a thumbing of the nose at the American people. They don't agree with it. We need to change it. We're willing to work to get it changed to where we don't have a massive increase in the government influence in health care. Well, as a practicing physician for over 25 years, Bob, I have seen the reason we have a shortage of primary care doctors in this country today is because of Medicare's pricing mechanism. We have too much government. We don't need more. We need less.
Bob, just on this question of reconciliation, on the question of reconciliation, I've said all year, as chairman of the Budget Committee, reconciliation cannot be used to pass comprehensive health care reform. It won't work. It won't work because it was never designed for that kind of significant legislation. It was designed for deficit reduction. So let's be clear. On the major Medicare or health care reform legislation, that can't move through reconciliation. The role for reconciliation would be very limited. It would be on sidecar issues designed to improve what passed the Senate and what would have to pass the House for health care reform to move forward. So using reconciliation would not be for the main package at all. It would be for certain sidecar issues like how much does the federal government put up to pay for the Medicaid expansion? What is done to improve the affordability of the package that's come out of the Senate, but it would not be used. Well, that's not a reasonable position to take, Congresswoman. We know that repeatedly for health care, certain provisions, for example, children's health care, the CHIP program, was done through reconciliation. COBRA, for people who lose their jobs, that was done through reconciliation.
So
on minor issues, on relatively minor issues, it's totally reasonable.
But this is not a minor issue.
Well, health care reform writ large would not be, I've just said, health care reform, the major package would not be done through reconciliation. That would be unreasonable. But that's not going to happen.